Alright, leg length discrepancy. What you're going to do is you're going to take the tape measure and you're going to measure the medial malleolus right here. You're going to measure up to the AS-IS right here on both sides. So if they're the same length on both sides but yet one leg still appears shorter than the other one, then you measure same spot, medial malleolus on both legs to the umbilicus. That should give you, if it's a true leg length, it'll be muscle overcontraction. You'll have the difference in measurement will be when it goes to the umbilicus. I'll go over that later. Okay. Now, to test for femur length, Allis sign. Make sure the feet are together like that. You want to check the plane here.
Okay.
Now, the other part to that is testing the tibial length. Tibial length, the most accurate way to do it is like this. You just bring it up, see how they measure out. That'll take care of the tibia and the way the femur's out of the way. You can figure out which one of them is not right. Craig's test. I'm going to have them prone. You're going to palpate the greater trochanter here. You're testing for anteversion of the hip, which basically means the angle here is, I believe, wider than it should be. So all you're doing is rolling them about 10 to 15 degrees each way. You should feel the trochanter kind of disappear as it gets to here. That's normal. If it doesn't, then it's sticking out.
So you're doing internal, external rotation?
Yeah, you're just doing this feeling on the trochanter, okay?
Until you feel what again?
So it should duck away, like right about when you get to here, it should start to roll in. That way you know it's normal.
So then this little thing will disappear and you'll start feeling just like solid bone?
No, you're feeling bone to start. You should start to feel more soft tissue as the muscles come into play.
Gotcha,
here.
Soft tissue.
Okay.
Viewers would like to know that.
No problem. Ober's test.
Ober's test.
Ober's test for TFL overcontraction. So, you've got this guy up here, stabilize the hip, you're pulling it back like this, and then you got it?
Yes. It's easier to see like that.
You can have slight knee bend like this. If you bend it all the way, then it shortens the muscle, it shortens the TFL.
So you don't want to bend it all the way?
Well, depends on what you find here. If you bring it back, and then you slowly lower it down, and you're basically trying to see if there's any spasming within this muscle here. If it gets, kind of does like this motion, you know that there's an overcontraction there.
Okay.
Alright. Thomas test is for overcontraction of the rectus femoris. I need an arm for this.
How about two?
Just one would be alright. If I could attach it. Alright, so anyway, you're going to have them hold their knee up like this. And they're flat on their back.
Okay.
If it's overcontracted in the rectus femoris,
I'll hold their knee.
Their knee will pop up off the table as opposed to laying flat. Their opposite knee will pop up. Okay?
Okay.
You can also have overcontraction of the iliopsoas muscle here, in which case the middle of their back,
lumbar?
The middle of their back, their lumbar, will pop up off the table.
Gotcha.
Now modified Thomas, same thing except they're hanging off the table. One arm is holding this leg up, and you want to see, basically normal is this will hang down. If it comes up like this, that means it's too tight in the rectus femoris.
Gotcha.
And their leg will basically look like that hanging off the table.
Alright.
Instead of like that, which would be a little bit more nice.
Okay.
What's next? Nachlas and Eli's. Nachlas, have them this way, testing for overcontraction of the rectus femoris. Push this foot to the ipsilateral buttock here, and you should get better range of motion than that. Eli's, you just go to the opposite side. You go to the contralateral side. Both testing for rectus femoris overcontraction. But you want to keep the femur this way, because you're testing this muscle.
Okay.
So you want to keep the femur on the table.
Okay, I got you.
Go that way and that way. Okay, Trendelenburg test. This is for believe just the pelvis being out of place. So it's like we do for, you know, when we're testing for like a PI motion palpation. You just palpate the PSIS, have them raise this leg, have them raise that leg, make sure that they are in the right spot. Pelvic obliquity.
Meaning they will stay at the same height, right? They shouldn't move.
They should move equally.
The hip,
Yeah, you know, like when this one goes up, this rocks forward, this rocks back. When this one goes up, this one rocks forward, this one rocks back. Just to make sure that they're doing what they're supposed to be doing. Hold them up again for me. Pelvic obliquity. You are putting your hands on the iliac crest to make sure they're even. Just to make sure one's not higher than the other.
Okay.
And alignment of the pelvis, you put one finger on PSIS, one finger on ASIS. In males, they'll be even. In females, they'll look like this. They'll be rocked forward because the female pelvis rocks forward about 15 more degrees than males.
Okay.
Alright, Flamingo test. Suspected fracture. Have them go like this. If this is a leg of suspected fracture and they jump up and down. Yeah, it's very dangerous. Hibb's test. What the fuck is Hibb's test for?
Hibb's test.
Hibb's test, right.
Yeah.
You're testing for SI joint. So you stabilize the opposite PSIS and you pull the leg out. Trying to open up this joint here, see if there's any pain. That's Hibb's test. Patrick's test. Usually acetabular labrum tears. So you'd want to lock the joint into place. It's like clunk test just for the lower extremity. So you would kind of move it back and forth. Testing for a labrum tear, you'll get that kind of clunking noise again.
Gotcha. Any pain?
Oh, there'll be pain.
There will be pain.
There will be pain. Gaenslen's are going to be on the side like this. And they hold their leg up again. And you, the doctor, push here and hold this down.
So you're pushing out that way, right here, that way.
Testing for
down.
SI joint.
Okay.
And then Lewis Gaenslen's, you just push them over on their side like this, and you pull this back again, testing for SI joint dysfunction.
Okay, so this is bent here?
Yeah, they're holding this too. Patient is holding this up.
Okay.
Both sides. So like this, have them off the table, then just push them over, have them hold it.
What's the difference between that and Ober's?
Ober's is testing for overcontracture in the gracilis. I mean tensor fasciae lata.
But it looks the same, doesn't it? What's the only difference?
I don't know. I don't know. Pelvic rock and iliac compression on their side, testing for any sort of instability in this joint, in the pelvic joint. So you push down very hard on the suspected joint. Pelvic rock, you do the same thing, you push down, except you just move it from side to side. Push them a different angle.
Laguerre's.
Alright, Laguerre's, you're testing for adductor problems. So you put their heel in your arm like this, and you stabilize the opposite thigh or knee, and you push down here, testing for pain in the medial area. That is Laguerre's. Anterior pelvic instability. Same thing, you're just testing for any sort of problems in this area. So pisiforms on the ASIS and you're pushing out like that.
What's your tissue pool?
Don't worry about it. Phelps tests. Testing for the gracilis. You have them prone. You can have them start out like this and they won't be able to do abduct because the gracilis are very tight. These muscles here will be very tight, so they won't be able to get the abduction. But if you bend their legs up, they'll be able to go a little bit farther because it shortens the muscle. So they'll be able to go a little bit farther. So that's Phelps test. And that's it for the hip.
Anything you'd like to say?
My name is Mark Murdoch. Thank you very much.
Goodbye now.